Good morning, and thank you for joining us for our annual enrollment 2026. I am Carla Cook. Along with me, I have Natalie Fee and True Kelly Martin. We are from HR Benefits, and also want to let you know that if you have any questions, please drop them in the Q&A part of our session, and then we will answer them as we go along. Okay, so our 2026 annual enrollment is taking place. It's going to be starting November 3rd, and it's going all the way through November 17th. That is a Monday through a Monday. All eligible employees must make an election in Opus, even if you are planning on opting out or declining our coverage. Enrollment only takes a few moments, and certain items require making an election every year. Elections are effective for January 1st, 2026, and cannot be changed during the year unless you have a qualifying event. And we'll talk a little bit more about qualifying events. We're trying to make enrollment a little bit easier each year, but we do have our annual enrollment website. It is up and running at this time. Please check in with that often because we will be updating it as we go along throughout the sessions, throughout our annual enrollment time. We're going to be offering various virtual Zoom meetings. We are also inviting some of our vendors to come on. We'll have morning and afternoon sessions, and your spouse or domestic partner are welcome to attend these sessions. We're recording these sessions, so if you miss something or if you tell a coworker that these sessions are recorded, or if you want to watch them later with your spouse or domestic partner, they'll be uploaded to our website shortly. We are also available to attend some of the department meetings upon request. We will be recording a OPUS walkthrough demo for annual enrollment, and we will also have a screenshot guide to help you navigate the enrollment screens. We are available by phone. You can contact us at 727-464-3367, option 1, or you can request a virtual and in-person appointment with the benefits team. We can also accommodate you if you need appointments outside of our regular business hours. You can scan this QR code to schedule an appointment online. So the question is, why must I enroll each year? And there are many reasons why all eligible employees must log into OPUS to complete the annual enrollment. You must attest to if you're a tobacco user, and it's every year you must do that. It is going to be defaulted to yes, you are a tobacco user. So if you're not, you do need to go in and choose that. If you do not go in and choose your tobacco usage, you will be assessed a $500 tobacco premium in 2026. If you want a flexible spending account, you must enroll every year. Just keep in mind that you cannot receive healthcare FSA rollover from 25 to 2026 if you do not have an active FSA in 2026. Currently, the rollover from 2025 to 2026 is $660. So if you want that rollover and you haven't used up all of your FSA from this year, you do need to select the FSA for next year. If you are choosing to opt out of our medical plans or if you have a domestic partner, you do need to complete the affidavit and also the tax certification for your domestic partner. That is every year. Those forms are not evergreen, so you do need to complete one every year. Those forms are due in the benefits office by the end of annual enrollment, which is November 17th. Oops, sorry about that. If you are planning on doing annual leave exchange, this is the time to enroll in that. You can only enroll in annual leave exchange during annual enrollment. So this is for your hours that you accrue for annual leave for next year if you like to sell those. So some of the highlights we have coming up. There are no premium increases, which is a good thing. The only increase that we have is our ROG legal plan. That is changing. The IRS has set the limits on the high deductible plan with the health savings account. There's an increased deductible and contribution limits to the plan, as well as increased out-of-pocket maximums. We are expanding our vision coverage with IMAD and also the dental PPO plans that we have through Cigna. We are also expanding the Teladoc virtual care coverage. The FSA vendor is changing from task to P&A group. And again, that FSA rollover from 2025 to 2026 is $660. And you do have to have that active FSA account for next year. AFLAC is requiring you to select which dependents you will be covering for 2026. And also, if you're adding a new dependent to your medical, dental, or your dependent life insurance, we do need to have that dependent verification. Just a little bit of an update. Our new FSA vendor P&A group will be joining us for a session on Tuesday, November 4th from 11 a.m. to 12 p.m. And also, I just wanted to throw out there that ROG legal plan, the increase that we're having is increasing from $9.80 to $10.62 per paycheck. We continue to offer the same two medical plans, the high deductible health plan with the PPO plan. I'm sorry, the high deductible health plan with an HSA and the PPO plan. Both offer 100% coverage for preventative care. They have the same UHC Choice Plus provider network. They have the same covered services. They also have the same biweekly premium. You can find additional information and full plan descriptions on our HR Benefits Intranet website. And if you have any questions regarding the coverage, you can contact UMR directly with that information.
Carla, we have a question, skipping ahead a little bit, but it's about flexible spending accounts. If somebody has an eligible expense that costs $100, but they only have $80 in their FSA, will it cover the $80 at least? I honestly don't know the answer to that, how Task handles that. Do you know? If
I
not,
think it's you can use it. You can use your $80 and then supplement with your own cash,
debit card or credit card.
your debit, your credit. Yeah, you would supplement that with that. We are adding enhancements to our Teladoc virtual care. It's 24/7 access, and it's for your convenience. It has affordable virtual visits. The physicians that are included in Teladoc are US board certified, and they have an average of 15 years experience. Our expanded coverage includes primary care. It's a P360 program, and you can, if you are having problems finding a primary care doctor, you can find a primary care doctor on Teladoc, and it also has specialists. They also have mental health professionals as well. They have a total of at least 40,000 clinicians in this Teladoc P360 program. It includes your annual visit. They can send lab orders so you can get your lab work done. They can also prescribe prescriptions, and they can also give referrals. You have a list of available providers that will be available to you. It includes their name, the gender, their clinical focus area, education, experience, photo, etc. They will also mail you a blood pressure monitor so you can take your readings and share that results with your doctor. Again, the big win for us is our premiums are not increasing in 2026. And Pinellas County continues to pay the majority of the cost for an employee only. The county provides about 97% of that cost. And it's about around average 85% for the other tiers that you see here. The rates are preferred premiums, and if you choose not to complete that biometric screening and health risk assessment due by November 30th, then an additional $500 premium will begin starting in May of 2026. So remember, there are two ways of you securing that biometric screening. There is a physician form through UMR and a direct lab form through Quest. At this late time of the year, our suggestion is to do the direct lab form through Quest. If you do have that physician form out there waiting for your doctor to complete, or you have completed it, please get that uploaded or faxed to UMR just as quickly as possible. But we do at this point suggest doing the direct to lab form through Quest. For those that are tobacco users and do not successfully complete a tobacco cessation program between August 1st of 2025 and March 31st of 2026, an additional $500 in premium will begin starting in April of 2026. There are a variety of ways to complete that tobacco cessation program. You can do it virtually or in person. You can go through our UMR health coaching or on-site health coach or virtual coaching. There also is Tobacco Free Florida that you could complete the cessation course. So you can also look on our website to give you a lot more information as well.
Carla, there is a question about premiums. It was about the legal plan, but it applies to all of our premiums. And I wanted to clarify that all of our premiums are deducted based on 26 pay periods. So it's not 2 a month, it's 26 pay periods. And then going back to the FSA real quick, a couple people have chimed in who have the FSA, and they said you can, if you have like an expense for $80 or an expense for 100 and you only have 80 in your account, you can do this 2 split payments. And somebody else just put the full amount on their personal card and then ask for reimbursement for the amount that was left in their FSA. So just in case people didn't see that in the Q&A.
Oh, great. Thanks for supplying that information for us. We appreciate that. So per IRS guidelines, we have increased the deductible amounts for our HDHP or high deductible health plan with the HSA. The single coverage has been increased by $50 and the family coverage has increased to $100. There are no changes to the PPO deductibles for 2026. If you do enroll for the high deductible plan, you will be automatically rolled into the Optum Bank HSA, and we will send you out a form to request to get the permission to open that account for you. As you can see, our contributions to the high deductible plan, Pinellas County will contribute $500 for employee only, and then employee plus one or more, we will deposit $1,200. That should be coming into your account around January 1st or just a couple of days later. And this is just a continuation of our plan comparisons. Preventative care is covered at 100% under both of the plans. This also includes your wellness exam, your basic labs. We also encourage you and your family to do this every year. Even if you're not on our plans, you know, it is always a good thing for you and your family to complete those wellness exams every year just to make sure everything is going well for you, and it is also a way to catch anything that may be coming up that you had no idea, maybe high blood pressure, high cholesterol. Good way to catch those before it gets out of control. All other services are either applied to your deductible, or you have a copay or a coinsurance. So that 20% refers to a contract rate that we have with UMR, and the doctors have with UMR, and they would apply this to also your behavioral benefits as well. So if you are on the high deductible plan, you meet your deductible, and then the 20% will be added to it till you reach your out-of-pocket. And then on the PPO plan, there are set copays that you have.
There's a question about Teladoc. Is it a subcomponent of the medical plans, or is it a completely separate service? So if you don't have the county's health insurance, like you're covered under your spouse, are you able to enroll in Teladoc only? And I believe you do need to be on our medical plan to have
It is,
access.
yeah, it is part of our medical plan. So you do have to be in our medical plan to be able to enroll in that Teladoc P360 program. So our vendor partner for our prescriptions is still Express Scripts, and nothing about the pharmacy plan has changed. You may view the preventative medication list on our website. We have uploaded it for 2026. And again, your prescriptions are either by copay or by coinsurance. Prescription coverage with Express Scripts to save money. If you are taking maintenance medications on long term, you need to have those filled by 90-day supply, either through the Express Scripts home delivery or at a Walgreens retail pharmacy. If your maintenance medications are not filled under the Smart 90 program, then you may be subject to pay the full retail cost of that medication out of pocket. Some of the medications are subject to quantity limits, so you may not be able to fill those at a 90-day supply. There are other cost-saving options that exist out there, such as discount cards, drug manufacturer assistance, or even a store that offers medications that are lower cost. So check those out before you purchase your prescriptions. You might find that less expensive than going through the Express Scripts. If you have any questions in regards to your prescriptions or the cost, please contact Express Scripts.
Someone has a comment that they've had issues with Express Scripts and heat sensitive patches, so they would recommend using Walgreens.
Sounds like a plan. Thank you for that. Okay. The health savings account, that is part of your high deductible health plan. So if you're on that, you will also have access to the health savings account. Health savings accounts are tax-free savings accounts, and they help pay for your eligible medical, dental, and vision expenses. That is for now or in the future. Actually, I noticed on Channel 8 had a big article on their uh, news app this weekend. So if you had a chance to take a look at that great article about the health savings account. New enrollments will automatically generate an open HSA account after you complete an authorization form and send it back to the benefits office, and we'll get that set up for you with that Optum Bank. You can transfer money from other HSA accounts that you may have, or you can leave them as is. The county's contribution will deposited into your Optum Bank account around January 1st or soon after that. During annual enrollment, you also will be able to set up your payroll deductions for your HSA account as well. You can also change your HSA accounts throughout the year. Just let us know and we'll get that set up for you to make your changes, or you can start it your contributions later on in the year if you need to. The IRS does set the annual maximum contribution each year. For 2026, that maximum contribution for employee only or single coverage is $4,400. For employee plus one or more, that maximum is $8,750. And just remember that those amounts also include what Pinellas County contributes into your account, so that $500 and that $1,200. For individuals that are 55 plus, you can contribute an additional $1,000 into your HSA account. So if your spouse is also covered under the high deductible plan, they can open up an HSA at a bank or another organization, and they can also contribute $1,000 to the HSA. This is a personal account and it belongs directly to you. So you are responsible for keeping receipts showing that the funds are used to pay for eligible expenses. It also means that the accounts is portable and it stays with you if you leave Pinellas County to retire or you take another job. You may use those funds now, or you can save them for future expenses. We like to say that think of it as a deferred Comp 457 plan for your healthcare expenses. It is a triple tax advantage. As long as you use the funds for eligible expenses, you are never taxed. You contribute tax-free, funds grow tax-free, and you spend tax-free as long as it is for eligible expenses. The high deductible health plan members may also contribute to the limited purpose flexible spending account, but these funds cannot be used for your healthcare expenses. You can only use those for your vision and dental. Once you have met the deductible on your high deductible health plan, then you can switch that over to a regular full purpose flexible spending account. Please don't confuse the health savings account and the flexible spending accounts. They are two different plans and they work differently. If you have any questions at all, please contact Employee Benefits. We'll be glad to help you along with the differentiating those two plans.
There's a question. You have to deduct the county portion from the total for the HSA, and that is correct. If you're trying to max out your contribution to your HSA, take into account what the employer is contributing per year for you.
And just keep in mind, there's 26 pay periods for 2026 that you can have those contributions coming out of. So when you're making your, and you're calculating those contributions. If you are enrolled in the flexible spending account, are you still required to complete the annual biometric screening? The biometric screening is if you're in the county's health plan, the medical plan. If you are opting out or declining our medical plan, you do not have to do your biometric screenings. And if you decline or opt out and you choose the FSA, that does not you do not have to do that biometric screening. That's only in the medical plan, either the PPO or the high deductible health plan. And it's only for employees only. Spouses and children are not required to complete that biometric screening. Good questions. We do continue to offer the same three dental plans through Cigna Dental. The basic dental PPO plan does not cover orthodontia. So if you're looking to have braces or Invisalign, you want to buy up to the orthodontia plan. But the basic dental plan does not include that orthodontia. Preventative care is covered at 100%. It includes 2 cleanings. Deep cleanings are not considered preventative, so you would have those fall under the basic restorative care, and it's covered at 80%. And then for your major restorative, it's covered at 50%, and that annual maximum is $2,000 per person for that plan to cover you for the year. We are expanding coverage for sealants up to age 19. It was at age 12, so we have expanded that. We also are expanding coverage for porcelain crowns on the second and third molars as well. The 2 cleanings are per year, not every 6 months. Usually your dentist office would do that every 6 months, so keep that in mind. You're welcome. The orthodontia plan is the same as the basic plan, but this one does include the orthodontia. And the orthodontia plan, it does have a lifetime orthodontia maximum of $1,500, and that is separate from the annual maximum of that $2,000. Again, that expanded coverage for you. And if you're already on the orthodontia plan and you're looking to switch over to the basic plan, please make sure that if you are still paying for your orthodontia program, make sure everything is covered and paid for before you make that switch, because we want to make sure that there's no problems on getting anything else paid. So if you're already on a program with orthodontia, you may want to stay on to that for another year before you switch over to the basic plan.
There's a couple questions about dental. Are there 2 cleanings per calendar year or rolling year? It's calendar year. And then are the sealants for cavities? What is the expanded coverage for crowns?
For the sealants, yeah, it used to be a composite, but the sealants are for cavities, and that expanded coverage for the crowns. It used to be the metal crowns, but now they are for the porcelain crowns. We continue to offer the HMO plan that is zero cost to our employees. The HMO plan is a very bare bones plan. You must go to a doctor within the Cigna Radius DHMO network. The cost of the procedures is based on a fee schedule, and that the dental cleanings and exams are free. Orthodontia is not covered under the HMO plan, and specialists are not covered either, except for if you have need a pediatric dentist for children up to the age of 13. Now, these DHMO network is usually some of the Coast Dentals. I think some Jet Dentals. There are other strip mall dental offices that have that are included in the Cigna Radius DHMO network.
Okay, a couple more questions. Does the dental HMO still cover fluoride treatment for adults? Their doctor said no last week. They had to have fluoride treatment due to sensitive teeth. I think we'd have to look at the plan doc on that, but I know for the most part, like the PPO plan doesn't cover fluoride for adults. I'm going to assume the HMO is the same, but we can double
Pretty sure
check
it
on
is.
that.
Yeah.
And then for the ortho, 1,500 lifetime max, that only covers braces. No part of the 2K will cover braces. I believe that is correct.
That's
Only the
correct.
1,500 is applicable. It's used to cover fluoride.
Used to cover fluoride for adults. We will check on that on the HMO plan, but I know the PPO plan does not cover it for adults. It's only for children. We will definitely check on that. And here are our premiums for the dental plans for you. They have not increased. Okay. Our vision coverage, if you are currently under our medical plans, you will have vision automatically. This is not a separate plan to enroll in. So you do have to be on our medical plans to have the vision coverage with IMEM. We are expanding our vision coverage. We are increasing the frame allowance from $130 to $150. We're also increasing the contact lens allowance from $100 to $150. We're having a new expanded coverage. It is called I360. You receive additional discounts when you choose one of the IMES preferred network of plus providers. So if you're looking on the website or on your app, you want to look for that plus sign next to the provider. So if you do use one of those plus providers, you get additional discounts. You can get up to 90% discount on an allowance up to $100 for a second pair of glasses. And approximately half of the current providers that are in the network are plus providers. Lens crafters, Target Optical, and most of the Pearl Vision are plus providers. So if you're using those, you can get additional discounts, like I said, up to 90%. So this next slide here is going to show you a little bit more of how that plus provider network is working. On your eye exams, if you were going to just a regular in-network, it was $10. Now you can get those eye exams with the plus providers for zero coverage. And then the additional frame allowance, then you could get an additional $50 off of some frames from that plus provider, and an additional 20% discount that gives you your total there of $51 instead of the $101. So definitely take advantage of that. When will this presentation be made available? We will have, we are recording all of our sessions. So one of these sessions will be on our website very soon. So keep watching that annual enrollment website and we'll get one of these recordings up for you. So if you are have contact lenses and you are wanting a pair of glasses to go along with those, we have confirmed that that second pair of glasses, you can use that second glass discount of up to $100 on those. Hinge Health, we have our employees and adult dependents that are enrolled in our county medical plan do have access to Hinge Health. This is a free digital exercise therapy program and it helps muscle and joint health. Hinge Health provides a personalized program and you also have a care team via video, and it may include a licensed physical therapist. They help you treat muscle and joint pain. You can recover from injuries, you can prepare for surgery, or just regain control of your body and your life. Hinge Health will be available on tomorrow, Tuesday, October 28th. We will be recording that session. It is from 10 a.m. to 11 a.m. And usually it just takes 15 minutes a day, 3 times a week. You can do it anywhere. If you're during lunchtime in your office, if you have a individual office space, just close the door and you can do your Hinge Health exercise program.
So we have a compliment about the Hinge Health program. Someone said they love Hinge Health. They've been enrolled for 2 years. Thank you for getting us this benefit. So you're welcome, and we're glad that you're using it and appreciating it. And then somebody else asked, does vision cover the spouse too if they are added to medical insurance, or is vision employee only? So anyone who's covered under your medical plan will also have access to vision.
Our employee assistance program through Optum UMR, that is the service will provide to you short-term resolution alternatives. There's assessment counseling, referrals, and it's no cost to you and your covered dependents. There's 100% coverage for 6 sessions of initial assessment counseling, and there's also intervention treatment. There's six sessions per person per issue per year. The other EAP sessions that you can choose from, maybe financial counseling if you're needing that, legal assistance, relationship management, if you need assistance in locating childcare or adult care, and there's so much more that you can use on our employee assistance program as well. If after 6 sessions, your care could transition to a behavioral mental health plan, and at that point, your copays or deductibles may apply to that. You can contact UMR for assistance with this transition if you're needing that. And every EAP provider is in network with UMR. Now, this EAP is very confidential. We do not, Pinellas County or the benefits office does not know who utilizes this benefit. Don't forget, we also have Lorelei Keefe. She is one of our on-site representatives from UMR. She is here part-time, but she has her own practice as well. But you can meet with her via phone, in person. She's located in the benefits area. Um, she also You can do virtual phone and also in person. If you are reaching out to Lorelei, we ask that you do that possibly by your own personal email or personal phone. Keep in mind that Pinellas County does get public records requests, so we want to make sure everything is kept confidential for you.
Here's a question about what type of legal assistance does the EAP provide? So, so it's a 30-minute consultation with an attorney for any question that you may have. And then my understanding is if you need to utilize that attorney further, then you would pay them directly or just continue um, on with them or using their advice. But there's also lots of legal articles on the EAP website that you have access to. Like, for example, if you need help setting up a will and a trust and you just like need to know the difference between the two, there's those kinds of articles online. Carla, do you have any other input on that?
Yeah, they have a lot of the sessions. And here's a little tip or trick that we were told as well. If because this legal assistance is available to you as well as spouses or your dependents. So if you get that 30-minute session, but if you and your spouse are needing this, you can extend that out to 30 minutes a piece, so you can get an hour with the legal representation or legal information. We still continue to use Securian for our basic life insurance. That basic life insurance is provided to our employees at no cost to you. The coverage amount is one time your annual salary. It's rounded up to the next 1,000. During annual enrollment, you do have the ability to purchase supplemental life insurance. During annual enrollment, you can choose up to $20,000 without evidence of insurability. As long as your new amount is equal to or less than 3 times your annual salary, rounded down to a whole 5,000. So if it is more than 3 times your annual salary, then you do have to complete and submit evidence of insurability. Please contact us in the benefits office to assist you with that evidence of insurability and how to complete that. Supplemental life as well as dependent life insurance is 100% employee paid. The county does not contribute to any of your supplemental or dependent life insurances. Just keep in mind, if both spouses work for the county, you are not permitted to cover one another for the dependent life insurance. And if you have children, only one of the parents can cover that dependent for that dependent life. Annual enrollment is a great time to review and update your beneficiaries. So not only for the county to remember that, you want to also check with the FRS, make sure your beneficiaries are updated with them. And if you have life insurance outside of the county, perfect time to remember to look over those beneficiaries as well. If you are choosing dependent life insurance for your dependents, you, as the employee, will be the beneficiary of that plan. If you're not planning on doing anything or making any changes, there's nothing you need to do during annual enrollment. So it looks like we have a couple questions.
Yes. Is the legal counseling, the 30 minutes, is it one time per year? And I do not know if
So
it's
you get
like,
six sessions per year for legal. So just like any other issue that you have, you get 6 sessions per person per year.
okay, and then who do I need to email to do that? I assume you're asking about the,
Life
actually,
insurance.
the life insurance. You can just email
Oh,
employee benefits.
yeah.
Um, so I'll put our email address in the Q&A. Oh, for the, yeah, for the evidence of insurance. Yeah. And then how old can the dependent be on the life insurance? It would be through the age of 26, the day before their 26th birthday. Does the county provide the continuation of life insurance if you retire? Yes, on the supplemental life. Do you want to expand on that, Carla?
Yeah. So the county does offer the basic life insurance that the county has purchased as an employee. You can pick that up as a retiree to pay for that. If you have supplemental and dependent life insurance, you will receive portability and conversion from our life insurance vendor, Securian. If you want to continue those two plans, you would work directly with Securian. But the county will offer you the basic life insurance to be retiree paid at time of retirement. Okay, our flexible spending account, we mentioned earlier that starting January 1st, the flexible spending account will be changing from task to P&A group, and new cards will be issued. The healthcare flexible spending account is also available January 1st. If you're wanting to enroll in that flexible spending account, annual enrollment is the time to do that. There are 3 different types of flexible spending accounts. We have the healthcare, dependent care, as well as the limited purpose. These accounts allow you to set aside the pre-tax dollars to use for qualified expenses. The IRS does set the limit, the maximum limit on these, and they have increased for both plans, the healthcare, or all 3 plans, the healthcare, limited purpose, and dependent care. Actually, the dependent care has increased. It's been 5,000 for a long period of time. They have increased that maximum dependent care account up to 7,500. A big win. So on the healthcare flexible spending account, the minimum that you can choose is $260. The maximum is $3,400. If you're on the PPO plan, you can use those for eligible medical, prescription, dental, vision, managed mental health needs. If you're on the high deductible health plan, it's a limited purpose use, and you can only use that for dental and vision expenses only because you have the health savings account uh, that is with the high deductible plans. So once you have met your deductible on the high deductible health plan, that limited purpose does expand, and you can convert that over into the regular flexible spending healthcare account. Just keep in mind, you can only roll over $660 of your funds this year over to next year, as long as you have an open 2026 flexible spending account. And we did receive from IRS that the rollover from 2026 to 2027 will be $680. Dependent care account, that is to be used for preschool, summer day camp, before and after school care as well, and you also have childcare. And that is up to age 13. So you can also have disabled adult children and adult daycare. That maximum again is 7,500. This is a use it or lose it as well. There are no rollovers for the dependent care account. So you want to make sure that you are adding up what you are going to be using for the whole 2026 and make sure you consider there's no rollover. We do have a P&A group will be joining us for an annual enrollment session. They will be there Tuesday, November 4th from 11 a.m. to 12 p.m.
All right, we have a bunch of questions. So, for the AFI coverage for a spouse and a child, do they have to be on the medical plan? And the answer is no. Uh, and then, will there ever be an option for life insurance to just cover a child? Since my spouse also works for the county, I have to pay the same price as everyone else who is covering a spouse and a child, but I get no additional coverage for my spouse as he is an employee. The answer to that is I don't believe there's discussions at the moment, but we can definitely look into that for the future. Will we have new cards by January 1st? Yes, that is the goal, especially with these FSA accounts. When you talk about the dependent care, can you go into more detail about when and how you can use it since it's not like the FSA medical card? So Carla, can you talk about that? I think she means like how you are able to spend like with the healthcare FSAs, you get all the money up front, whereas the dependent care, you get the money as you contribute to it.
Yep. And then when that money is in your account, then you can you can make a payment to your provider, or you can pay yourself back if you have that information that you have paid provider for the camps or daycare or before and after school care. You have to have that money in your account first before you can pay that provider.
And then with the dependent care, is it a reimbursement or can you do a direct payment?
Yes, you can do both.
Okay, late question about the EAP. Do EAP codes still exist for counseling or do you have to strictly use Optum now? I know you can use like Talkspace and some of those other virtual therapy. I believe there's codes, but I'm not sure. We can find that out for you for sure. Um, and then if you could just email us at employee benefits, that way we know who to send the codes to once we find those, if we do have them. And then will we be able to receive additional cards for the healthcare FSA? I have a child attending college in a different state who could use it for their eligible expenses. I requested an additional card through Task, but never received it. So you should be able to, now that we're moving over to PNA, I'm sure they'll have that feature as well, but I would encourage you to attend that info session where they can answer you directly on how to obtain an additional card. And what if I leave the county mid-year? What happens to unused funds? Carla, you want to answer that?
Sure. So usually all your benefits would end at the end of the pay period. You do have up to 90 days to ask for reimbursement for any funds, any expenses that you had up to um, your last pay period. If you're wanting to, if you have contributed more than what you've used out of your FSA, you can continue that with COBRA. You'll receive COBRA information from our COBRA vendor, which is ITDM COBRA card. So you can continue that throughout the rest of the year if you have not used more than what you've contributed.
Okay, another question. I pay before and after care YMCA camp for my grandson. Am I able to use a dependent care account to cover that? Uh, I don't think so if they're not a tax dependent. Um, so,
Yeah, they have to be a tax dependent to be able to use a dependent care account.
okay.
Moving on.
Mhm.
Okay, so our voluntary benefits, we do have the 3 supplemental medical plans, and that is through AFLAC. We have the accident, critical illness, and hospital indemnity. They are separate plans, so you don't have to enroll in all three of them. You can. Plus, also, you do not have to be enrolled in our medical plan to be able to enroll in the AFLAC voluntary benefits. You may choose these during annual enrollment, and the only time you can make a change is if you have a qualifying event. And we'll talk a little bit more about the qualifying event. All of the plans offer a low and a high plan, as well as individual and family coverages. And how these plans operate is if you or one of your dependents experience a condition or an injury, once that claim is received or processed, you will get a lump sum payment from AFLAC. All of these plans are 100% employee paid. It is post-tax instead of the pre-tax that you can do with medical and dental. So it is post-tax on that. As well, we have expanded, it started last year. We used to just have a wellness benefit on the critical illness. It was $25. We have increased the critical illness. You can get a $75 wellness benefit, and you can get a $25 wellness benefit on accident and hospital. So if you go and do your wellness benefits, you have all three plans, you can uh, request those benefits as well on all three plans. The benefit plans, these voluntary benefit plans, they have no pre-existing condition exclusions. So if you do have a condition at the time that you enroll, you can still be covered for expenses that occur after your enrollment date. And starting for annual enrollment this year, you do need to select which dependent will be covered for your supplemental medical plans. The critical illness, children are automatically covered, so you will not have to choose your children for that critical illness. All of our information is included on our website, and we did have AFLAC, and we will upload that recorded session. They were with us last week, so we will be getting that onto our website just as quickly as possible.
Okay, I have a couple questions. Can I enroll in the voluntary benefits when I retire next year, or does it become an independent plan? So it would become an independent plan if you wish to continue the voluntary benefits. Is the wellness per person covered on the plan as well? Is the wellness per person? Yes, it's for each dependent that you have on your AFI plans. They are eligible for the wellness screening benefit. Does the wellness benefit also apply to yes. Um, the AFLAC rep said the critical illness has a pre-existing condition clause. And that's correct. Do you want to expand
Yeah,
on that?
if you do have a pre-existing condition at the time that you enroll, um, there are some additional information that they will need, and they will cover some of your um, expenses for that condition. But definitely you want to speak to AFLAC. It's also included in our plan documents as well.
Does this include dental for pre-existing condition? I'm not quite sure what we're asking here.
So for dental, if you're on our dental plan, it does not have pre-existing condition. If you're trying to get something on the AFLAC, I'm not exactly sure what if they have dental program for the AFLACs. We can check that out, but I think that most of the voluntary benefits through AFLAC is medical needs. So, but we can definitely kind of look at that and check that out.
All right. If somebody has a dispute over being declined a prescription medication, who do we take that up with? HR, Express Scripts, or UMR? So I would say Express Scripts would be the first step, but if you're not getting where you need to get, with them, you are definitely welcome to reach out to us in employee benefits and we'll help advocate for you. Um, yeah.
Okay. One of our other voluntary benefits we have is legal through RROG. That gives you an access to network attorneys, and they're just a phone call away for legal help, and they can also represent you. The attorney fees are 100% paid in full for most of your covered matters. Um, they also give you access to DIY documents that you can use to create a variety of different legal valid documents. Um, this also includes state-specific templates as well. The ROG attorneys can assist you with creating a trust, navigating a divorce, selling or purchasing a home. There's a whole lot of long list of legal matters that ROG can help you with. If you enroll into the ROG legal plan, that also extends coverage to you and your extended family, not only your dependents that's under your household, but that can include your parents, your parent-in-laws, and as well as your grandparents. They don't have the full benefit, but at least they do have a lot of the basic wills, trusts, and also some DIY documents as well. Again, that legal plan is increasing in the premiums. It's increasing from $9.80 per paycheck to $10.62 per paycheck. ROG will be at one of our info sessions on Monday, November 3rd, and we will also record that session for you. And we have a couple of questions.
Sorry, I was talking the whole time and I was muted.
It's okay.
Yes, we have a couple of questions. Does UMR still have, I think they mean on-site to advocate for the employee with billing? And yes, we have Jace, and he is available to help you with any UMR questions. I'll put his contact information in the chat or in this Q&A. And can the county require Express Scripts to send prescriptions in the warmer months with temp protection packaging? So I know Express Scripts sends their prescriptions if they need to be refrigerated and like packages with cooler or ice packs. We don't know what else we could require them to do. Oh, do you know, Carla?
It it is eyesight. It was separate from Jace. I'm not sure what the eyesight is, but we could definitely take a
Yeah, I
look.
don't know what that is.
I'm not exactly sure. Yeah, but we can definitely check that out for you. Okay. Identity protection. We have that through Allstate. Uh, this plan helps protect you from that large trail that we leave behind from online activities. We have financial transactions we're doing all the time. Also, being on social media, that also leaves a huge footprint. With the Allstate Digital Footprint tool, you can see and control your personal data. It's pretty cool. You'll be able to monitor your social media accounts. You can view and manage your alerts. It's all real time, and you can catch fraud early. They also have the Tri-Bureau credit reports and scores available to you as well. If you choose the family plan, you can add anyone under your roof or your wallet, is what they say, meaning anyone who lives with you. It doesn't have to be an actual, it does have to be somebody that is financially dependent on you. You can also add any family member 65 or older. And it's regardless from where they live. So if you have your parents are 65 or older, they can also use this voluntary benefit through identity protection. All the family members, they must reside in the U.S. and have a valid Social Security number as well. Let me see, yeah, AIP or all state identity protection will be on our virtual website tomorrow, or our session tomorrow. From 10 a.m. to 11 a.m. We will also be recording that too. We are changing our disability from United Healthcare to Reliance Matrix starting on January 1st. This is for our short and long-term disability, as well as the Family Medical Leave Act, the FMLA. For those individuals with an active leave that ends in 2026, there will be no disruption to your leave. That will continue with United. We will have more information on our website. We are updating that almost daily. And that will include in that transition to Reliance. Short-term disability and long-term disability, it's a benefit that can replace part of your income when you are unable to work due to an illness or an injury that is not work-related. They will be starting with Reliance Metrics. The Q&As will be on our website, and you will have to call them to initiate any short-term disability and FMLA processes after January 1st. Employees that are not temporary employees all are eligible, and you have once you are working 20 hours or more per week are eligible for the short-term disability and long-term disability. Benefits are available the first of the month after your 30-day wait, for at least for new hires. You will, on your short-term disability, that it will give you 66 2/3 of your income. For new employees, you have 6 weeks of eligible benefits, and then for each successful year of service, you get 5 additional weeks and up to a maximum of 26 weeks. So if you are approved for short-term disability through Reliance Matrix, you will be paid up that 66 2/3 of your base pay. So if you're earning $15 an hour, you would receive about $10, and then you would supplement that with any leave time that you have if you've accrued enough in your leave bank. Just keep in mind, these claims are filed through Reliance, not the county, so you will definitely need to call them to start that short-term disability benefit. You can call them directly, or you can also do online. You classified employees do have a 7-day waiting period. Exempt employees do not have a waiting period. Long-term disability, that coverage is for exempt employees when you're eligible for the rest of your benefits. Classified employees, you can purchase long-term disability after 1 year of service. And then once you have reached 5 years of service, the county does pick up the cost of that. The waiting period for long-term disability to begin is at 26 weeks. You cannot enroll in long-term disability during annual enrollment. So if you miss that for classified employees, if you miss that initial enrollment, you can reach out to employee benefits to complete an enrollment to see if you're eligible for that long-term disability, or it will start up with county paid at 5-year anniversary. We have partnered with FedLogic. It provides federal and state benefits information, and they can advocate for our employees. It's also available to our retirees. It's an independent resource to help you navigate and maximize any type of benefits such as Social Security, Medicare, even Medicaid if you have questions in regards to that. Our experts at FedLogic, they can help you tap into all benefits available that you may not even know that you have available to you. They're confidential, it's unlimited, and it's free to our employees or retirees and also for your household members. They're not going to try to sell you anything. They're not going to endorse products or they're not going to any promote any of those products. They are a free service to you and you can give them a call and you can set up a phone consultation with them. Annual leave exchange, this is the opportunity, annual enrollment. This is when you can exchange leave that you will be accruing in 2026. It's not what you have in your leave bank at now, but what you will accrue next year in 2026. You can sell up to 160 hours of your leave that you will be accruing. Your first accruals will go into your annual leave exchange bucket, and when it has maxed out where you have requested, then the leave hours will then go into your regular leave bank. To participate in the annual leave exchange, you have to have been with the county for 1 year as of October 1st. And the amount of exchange that you are wanting to do is based on your current leave bank as of the first pay in October, which would have been October 10th. So whatever you had in your leave bank, if you are wanting to sell less than 80 hours, you must have at least 40 hours in your leave bank. If you're wanting to exchange up to 160 hours, then you must have at least 80 hours in your leave bank as of that October 10th. You can choose if you want 1 time, 2 time, or 4 times a year to have that exchange paid out to you. You can have it cashed out on your paycheck, or you can have it rolled over to your deferred comp account. You can make that decision at the right before that exchange is about to happen. You'll receive an email from us saying that the exchange is about to be paid out on your paycheck, and you can actually select, "Oh, no, I'd rather have it to my deferred comp." I know a lot of people, if they choose 4 times a year, they may have their first 2 exchanges paid out to the rolled over to the deferred comp, and then when it gets closer to the holidays, they want that extra cash into their paycheck. Um, so you have that opportunity. If you're choosing 1 time a year, just keep in mind that 1 time a year it is paid out in November. It's not at the beginning of the year, but it will be paid out at the end toward November. I think it's usually on the last pay of November.
There's a question if somebody signed up for 2 times a year for annual leave exchange, but they leave before the end of 2026, what happens if there were still exchanges scheduled? So I would assume they just get that
It's
all
rolled
paid
over.
out.
Yeah, it
Yeah,
just rolls over into your regular annual leave bucket, and then it's cashed out to you.
yeah, you don't lose that.
Unless it's more than 3 times your annual accrual rate. So keep that in
Hmm.
mind too. Just a reminder, if you do not enroll into your annual annual enrollment for next year, you will be defaulted as a tobacco user. So we want to make sure that you get in and choose if you're a tobacco user or not. If you are a tobacco user, there is a $500 annual premium that will be applied to our tobacco users unless you complete a cessation course before March 31st of next year. What is a tobacco user? It's someone that has used tobacco at least once in a week in the past 3 months. Tobacco is defined as cigarettes, e-cigarettes, cigars, pipes, chewing tobacco, dip, snuff, or hookahs. Once you complete that, if you do start receiving that $500 extra premium, once you have completed a cessation program during the year, we will stop that premium going forward. Okay. Dependent verification, if you're adding a new dependent to one of your medical, dental, or your dependent life insurance, we do need to have that verification. If you're adding your spouse to the plan for the first time, we would either need your previous year's federal tax return, that's just the first page. You can remove make a copy of that form, remove social security numbers and financial information off of that and send that over to us. If you don't have that, then we just need marriage certificate and 2 joint financial statements. If you're adding children onto the plans, we just need a copy of their birth certificate. If you provided that last or this year, for this year, you do not have to provide it again for next year. Qualifying event. Other than annual enrollment, once you make your annual enrollment benefits, they are good for the whole year of 2026 unless you have a qualifying event. Qualifying event can be a marriage, a divorce, a birth. Maybe your spouse has insurance coverage elsewhere and they lose that insurance. Then at that time, you can make a change to your benefits and add these individuals on your dependents. If you're not sure if one of your events is a qualifying event, definitely reach out to the Employee Benefits Office. Based on IRS rulings, you have 31 days from the date of that life event or qualifying event to make a change. So if you get married and you decided, oh, shoot, I forgot to add my spouse on, and it's about 60 days later, we're not going to be able to add your spouse onto your benefits because it's past the 31 days. So reach out to the benefits office as long as we get that qualifying event form. Maybe you're not going to have backup information. You have a birth of a child and that birth certificate is delayed. You can still get that qualifying event form over to us so we can get that process started and you can follow up with that birth certificate. Make sure if you're adding a new individual onto your plans that they are also added into EBS Opus so we can make sure that dependent is added.
Someone is asking if retirement is a qualifying event.
It is a qualifying event. So if you have a spouse that is retiring and you're wanting to add them to your insurances, definitely that is considered a qualifying event. Or if you're retiring, that is also a qualifying event. Okay. Some other benefits that are available to you, we have our wellness programs. They have a lot of classes, challenges, educational programs, and also health screenings. Even if you opt out of our health benefits, you can still participate in the wellness programs. Spouses, domestic partners are also can be enrolled in some of these health benefits and the wellness programs. Deferred compensation is another great benefit that we have. Um, sorry, my screen just got covered up. The county does not contribute to your deferred compensation 457 a plan. We do have four participants. We have Empower, Mission Square, Core Bridge, and Nationwide. You could definitely check all 4 of them out, find out who would work best for you. Who do you like? And you can participate anytime you want to. You don't have to just wait till annual enrollment to enroll in one of our 4 vendors. You could do that anytime throughout the year. You can increase your contributions. You can pause your contributions. That is all made through the payroll office, and those deductions will come out of your pre-tax contributions. We will be starting up a Roth deferred comp that will begin in January 1st, 2026. There's going to be some educational information coming out very soon. So please watch your emails for this important information that'll be coming out for you.
A couple of questions on deferred comp. One, if we leave the county employment not by retirement, can we leave our investments in the county's deferred comp plan to continue to grow? And the answer is yes. You can leave your money with your deferred comp provider for as long as you want. That money's always yours. And then is this a 457 Roth being added? What is the benefit versus a regular Roth IRA? Um, Without getting too in the weeds, basically Roth IRA is post-tax deductions versus currently right now with your deferred comp, if you're making contributions, it's on a pre-tax basis. So then when you go to retire with a Roth IRA, or sorry, you're asking
It's
about
not
a
a,
457 Roth versus a Roth IRA. Um, IRAs are personal accounts.
yeah, it's an individual retirement account. That is not what we're offering. We're going to be offering a Roth deferred comp. There are some differences between that. The deferred comp is more the government portion of it, and it gives a lot more benefits than just a regular individual retirement account. More to come on that. Can't talk a whole lot about that because I'm still a little ignorant about the two plans, but we will have a lot more educational pieces. We do have our financial advisor that is helping us out and getting some Q&As coming out that will talk about the differences between the two plans. That should be coming out very soon, so keep watch of your emails. Okay, ways to guarantee to save you money. So you are using your maintenance medications, please use the Smart 90 program. If you do use tobacco, make sure you complete a cessation program and save that $500 extra premium. Um, complete that biometric screening before November 30th. Make sure you go to Quest, get the direct to Quest, get your lab work done, and complete your health assessment form on UMR website. Use flexible savings account to save money on your qualified healthcare expenses. Use Teladoc for sick pays, and that helps lower your copays as well. Use that urgent care instead of the emergency room unless it is a full-blown emergency. You can save $225 if you're on the PPO plan, or your saves on your deductible on the high deductible plan. And the deferred compensation program, and also helps you save money for your retirement as well, to have some extra retirement funds for you. Don't delay on that biometric screening and do that physician form. Like I said earlier, make sure you do that Quest, direct to Quest, and get that biometric done sooner than later. So you can also do the wellness rewards. You can earn up to $200 per year or cash equivalent. Also, spouses and domestic partners can also earn up to their own $200 a year, but it will be in your check or in your points bank. Participate in those wellness activities. They are fun. They are good mental and physical overall health. And we do have that You Decide discount program, car insurance, theme parks, vacation expenses, cell phone discounts. Great way to save money. Also, remind you, if you're wanting your W-2 or your 1099s on electronic forms, please elect to those into Opus. And you do that through employee self-service. Make sure you do that before the deadlines of those. For your W-2s, you need to have that done before December 31st. And on the 1095s, I'm sorry, that should be done before January 31st. And then we'll let you know when those are available, and you can just download them from Opus. If you choose to have those as paper, they will be delayed to you. I know W-2s will have to be out by January 31st, and the 1095C forms have to be out by March 2nd. If you've already opted into those, there's nothing you need to do. They will still continue to be downloaded when you request those. Don't forget the Maintain campaign. It's our annual challenge that we have over the holidays. Just helps you stay healthy, keeps you on track. And that starts Monday, November 17th. So you want to make sure that you register starting November 3rd for this. Here's our resources. The annual enrollment website is up and running. More information is added daily, so check in and see if there's anything else up there. We will have recordings uploaded as long as the vendors that are joining us will have those recorded sessions up. And check your mail for any important information that will be coming out to you next year. Make sure that you look for that Pinellas County logo on your mail. If you see that, you know it's important. So please open up that mail, check through your mail. So do we have any other questions? Just remember, annual enrollment starts November 13th. I'm sorry, November 3rd, and it goes through November 17th. We will send out an email when it is open and ready to go. Also, don't forget, once you do your annual enrollment, to download or print your confirmation statement. Keep it handy. Thank you for joining us today. Okay.
There's a question. Oh,
Go
you're
ahead.
gonna. Oh, are the requirements for an unmarried partner the same as last year? Are we talking about dependent verification? I think.
No, domestic partner. Yes, if you have a domestic partner, you should do your domestic partner affidavit and tax form. That is on our website. It was uploaded on Friday, so you can find those forms there. We need those in by November 17th. Everyone in the benefits office are notaries, free of charge to use. So if you need any of those forms notarized, just stop by the office. We'll take care of that for you. You're very welcome. Thank you. We'll stay on for a few more minutes. I'm going to go ahead and stop the recording as well.
If you sign up on November 3rd but would like to change something before the 17th, can you make a change? Yes, you can. You can make changes all the way up until the 17th.
Thank you. You have a great day, great week as well.